Okay, good morning and welcome to the Tuesday, June 2nd, 2020 Board of Commissioners for Todd County's meeting. And again, the public is not allowed to attend in person, but you certainly can view the meetings live stream, and we welcome the public who is viewing us or listening to us. Present at our meeting is Lauren Fehlbaum on the phone, Steve Ock is on the phone, the sheriff, Lisa Chapin from Health and Human Services on the phone, and I believe both Karen Knauber and Jason Brown are on the phone. News media. In person is Denise Gaida, our auditor treasurer, Chris Pelzer, our coordinator, and Jackie Ock, our Health and Human Services director. All commissioners are present, so I will call the meeting to order and we'll stand for the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. All right, thank you. Do we have any corrections or additions to the agenda?
I have none, Mr. Chair.
Okay, and I have a motion to approve the agenda as it stands.
So moved.
Motion by Commissioner Kneisel. Is there a second?
Second.
Second by Commissioner Becker, I'm sorry. Any discussion? If not, all those in favor say aye.
Aye.
Opposed? Carried, thank you. Consent items.
The one item we have today is the meeting minute approval for May 19th, 2020 meeting.
Okay, well, had a chance to read them. Is there a motion to approve?
So moved.
Motion by Commissioner Erickson. Is there a second?
Second.
Second by Commissioner Newman. Discussion? If not, all those in favor say aye.
Aye.
Opposed? Carried, thank you.
First item I have today then is the auditor warrants for May 2020. Background was sent for your review. The recommendation is to approve the May 2020 auditor warrants with an ACH and a regular manual payment totaling in the amount of $9,916,171.18.
All right, you've heard the board action. Is there a motion to approve?
So move.
Motion by Commissioner Becker. Is there a second?
Second.
Second by Commissioner Newman. Discussion? If not, roll call, please.
Commissioner Becker?
Yes.
Commissioner Newman?
Yes.
Commissioner Kneisel?
Yes.
Commissioner Erickson?
Yes.
Commissioner Kircher?
Yes.
Next item I have then is the commissioner warrants. Background again was sent for your review. Recommendation is to approve the commissioner warrants with an ACH and a regular manual payment totaling in the amount of $75,955.79.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Kneisel. Is there a second?
Second.
Second by Commissioner Newman. Discussion? If not, roll call, please.
Commissioner Kneisel?
Yes.
Commissioner Newman?
Yes.
Commissioner Erickson?
Yes.
Commissioner Becker?
Yes.
Commissioner Kircher?
Yes.
My next board action would be the Health and Human Service Commissioner warrants. Background is sent for your review. Recommendation is to approve the Health and Human Service Commissioner warrants with an ACH and a regular manual payment totaling the amount of $27,634.38.
Okay, you've heard the board action. Is there a motion to approve?
So moved.
Motion by Commissioner Erickson. Is there a second?
Second.
Second by Commissioner Becker. Discussion? If not, roll call, please.
Commissioner Erickson?
Yes.
Commissioner Becker?
Yes.
Commissioner Newman?
Yes.
Commissioner Kneisel?
Yes.
Commissioner Kircher?
Yes.
The last item I have then is the Health and Human Service SSIS warrants. Background is sent for your review. Recommendation is to approve the Health and Human Services SSIS warrants with an ACH and a regular manual totaling in the amount of $50,587.87.
Okay, you've heard the board action. Is there a motion to approve?
So moved.
Motion by Commissioner Kneisel. Is there a second?
Second.
Second by Commissioner Erickson. Discussion? If not, roll call, please.
Commissioner Kneisel?
Yes.
Commissioner Erickson?
Yes.
Commissioner Newman?
Yes.
Commissioner Becker?
Yes.
Commissioner Kircher?
Yes. Okay, thank you. Public Works, Lauren.
Good morning, everyone.
Morning.
Morning.
Our one item on the agenda this morning for Public Works is a request for final payment authorization for a 2019 bituminous highway construction contract. I'll just give a quick background. These were our projects located in down in the south part of the county last year. In 2019, with Central Specialties being the contractor. All the work was completed this this year, or last year, and remaining work completed this year, and we're asking for a approval to make our final payment to them. So our options are to approve the attached resolution or do not approve the attached resolution. And our recommendation is to approve the attached resolution, making final payment to Central Specialties for their remaining value of $59,665.41.
Okay, you've heard the board action and request. Is there a motion to approve?
So moved.
Motion by Commissioner Canizzo. Is there a second?
Second.
Second by Commissioner Becker. Discussion? If not, all those in favor say aye.
Aye.
Opposed? Carried. Thank you.
Thank you.
Yep.
Thank you.
Sheriff, Steve?
Good morning, all.
Morning.
One board action I have today is to purchase a squad car. This will be to replace the current 2000 F-150 that we use for water patrol and snowmobile patrol. And we'd like to replace that. Background would be, we'd like to purchase a 2021 Chevy Tahoe from Ranger Chevrolet of Hibbing. The price of the Tahoe is $38,698.42 on the state contract bid. This squad is a budget item in the 2020 budget. Options are to approve the 2021 Chevy Tahoe or two, not to approve the purchase of the 2021 Tahoe. Recommendation is, of course, to approve the purchase of the 2021 Chevy Tahoe. And like I said, it is budgeted.
Okay, you've heard the board action. Is there a motion?
So moved.
Motion by Commissioner Erickson and a second by Commissioner Newman. Is that to approve?
Yes.
All right. Any discussion? If not, all's in favor say aye.
Aye.
Opposed? Carried. Thank you.
Thank you.
Yep.
Appreciate it.
Health and Human Services.
Good morning, Commissioners, Mr. Chair. Before you today, we have the Fraud Prevention, Investigation, and Prosecution Interagency Agreement. Some background. The Todd County Health and Human Services, the Todd County Sheriff, and the Todd County Attorney desire to establish cooperative procedures for the effective enforcement of food support and Minnesota Family Investment Program, which is known as MFIP, rules and regulation, investigation and prosecution of food support and MFIP fraud cases, and for the effective enforcement, investigation, and prosecution of other public assistance program fraud cases. Options is to approve the Fraud Investigation Program Cooperative Agreement effective January 1st, 2020 between the Todd County Health and Human Services and Todd County Sheriff and Todd County Attorney, or to not approve. Lisa does have some background that I would like to have her provide to the board. We've been working with our Sheriff's Office for about 4 months in this program. The state has asked that we have a contract with our Sheriff's Office and County Attorney's Office, so this is why this is being brought forth today. This is grant funded. Go ahead, Lisa. Oop, did we lose her?
Good morning.
There we go.
Morning.
Go ahead, Lisa.
I just wanted to give a little overview of how it's been going since Investigator Winter has started as the fraud prevention investigator. And so with the grant, we applied for it and received a grant from the state of Minnesota for fraud prevention investigation services to be provided by our Sheriff's Department. We were awarded $22,500 for the year of 2020 and $45,000 for 2021, and that's to fund 0.4 FTE. So 100% of the investigator's time is reimbursed through this grant. Investigator Winter is doing a fantastic job, and we've seen some very good results since he started about mid-February. Just to give you a little idea of what he's been doing. So upon identifying someone that may have committed an intentional program violation and determining if the administrative disqualification process will be pursued, which is basically a hearing before a DHS judge, a Department of Human Services judge. The accused individual must be offered the opportunity to waive their appearance before the hearing judge and simply agree to the disqualification penalties, whether they admit to the facts or not. So far, Travis has gotten 3 waivers signed, so that means those people have accepted the disqualification and will not be eligible for continued assistance. They're disqualified for 12 months for their first offense. We've got one case that he's referred to the county attorney for criminal prosecution, and so far our savings, which are calculated by taking the current month's benefit, what somebody is receiving for a month, and subtracting the correct benefit amount, we're currently at $7,856. The state then multiplies that amount by 4 to calculate an approximate yearly savings. So right now, since February, we've seen a savings of $31,424. In addition to that, we also need to look at overpayments. So what people have received in the past, we go back and recalculate that, and we have to date cited $32,812 in overpayment since mid-February. And on an average, the county is able to keep 25% of our overpayment recoveries as an incentive for the work that we do. So to date, our approximate savings and overpayments equal $64,236.
Lisa, if I could, this is Dave.
Yes.
Once you take them off the list or they sign this thing that they'll no longer receive benefits, can they county shop and find another county to get benefits?
No, that follows them throughout the state of Minnesota.
Okay.
Yep.
All right, thank you.
You're welcome. If they choose not to sign that waiver, and then we would request the administrative disqualification hearing, and then we would have that hearing, and the judge they usually have 90 days to make their decision as to whether they are upholding our decision or ruling in favor of the client.
When do we stop benefits?
Immediately, unless the only way it would be right away. As soon as we can give a 10-day notice. We always have to give 10 days whenever we impose a negative or adverse action on any case.
So if the investigator finds that there is fraud, you would give a 10-day notice?
Are upholding our decision or ruling in favor of the client.
When do we stop? That's a delay.
Yeah.
Thank you. Sorry.
Is she still on the phone?
Lisa, you're still.
I am, but I'm hearing
No.
our conversation from the last minute.
Oh, you're okay. Commissioner Newman was practicing his technology. So,
Okay.
okay, I was
No.
just wondering if we just stop, whether they're found guilty or not, we just stop delivering benefits.
Once we determine that they're not eligible, we will act on that and wait for the hearing. But we would close
Okay,
based on the investigator's report.
yeah, okay, thank you.
Yes.
Mr. Chair, if
Yes.
I could, Jackie and Lisa, before we were working with more of a regional area, and this is a lot more better?
Yes, I would say, Lisa, we were reported out last year with the Cass County deputy. I believe it was 4 counties, and I'm trying to recall
Okay.
back. It was Cass, Todd, Wadena, and Hubbard. I think our savings last year was $700.
Okay.
So we've very much,
Changed.
yeah, working
Okay.
those cases now. So it's a big windshield area for one full-time person to do these kind of investigations, so we were on a outside border of that, so it made it very difficult for them to be able to come and follow through on a
Okay.
regular basis. So this is why we went to the state and asked what we could do, how we get out of that contract, and they had offered that this, actually they didn't offer, they suggested we go to the website and look for a grant, so.
Okay, anything else, commissioners? Need a motion then
Do you
to,
want me to read the recommendation?
oh,
Mr.
yes, I'm
Chair?
sorry, go ahead.
Okay, the recommendation is the Todd County Board of Commissioners approves the following by motion. Our recommendation is to approve the fraud prevention investigation program cooperative agreement effective June 1st, 2020 between the Todd County Health and Human Services, Todd County Sheriff, and Todd County Attorney.
Okay, you've heard the request. Is there a motion to approve that?
So moved.
Motion by Commissioner Kenizel. Is there a second?
Second.
Second by Commissioner Becker. Is Steve Ock still on?
Yep, I'm here.
Steve, this has taken up some time, obviously, of one of your investigators. How's that to your productivity as far as investigators are going?
He's doing it 40% of the time, so actually it's not adversely affecting his workload much at all. So
Okay,
I think we're seeing a great cost savings to the county in the savings here. So
well, this is something,
so far it's going well.
yeah, this is something I pushed for a long time, that we need to get on this stuff and stay on it. And of course, you know, I'm not a big fan of administrative recoup. I'm a big fan of prosecuting, because that sends a message to the others that we're doing something, so.
Yeah, and we do have that option. I believe we have one case up there right now, and like I said, he isn't backlogged on other cases right now, so I think things are running smoothly, and right now the 40% seems to be working quite well for us.
Okay, good. All right, anything else, commissioners? If not, all those in favor say aye.
Aye.
Opposed? Carried, thank you. Update.
All right. Just to give our board meeting update with COVID situation. Today, as of June 1st, which was yesterday, Todd County had 318 lab confirmed COVID-19 cases. Many of the people with COVID-19 haven't been tested, as we know. So the laboratory confirmed cases represent only a portion of the number of people in Todd County who have had the positive lab confirmed COVID-19. Of the 318 cases no longer needing isolation is 159 individuals, which is about 50%. That's calculated as 14 days from their test date is what they're now recommending. Gender, you're seeing male is at 57%, where female is at 39%. State averages are pretty similar across the board with genders, averages. Unknown is 4%. Age range, anywhere from 1.2 years to 85.3 years for Todd County. Our average age is 37.8. State average for years is 30 to 39 years, right, as of this morning on their website as well. So we're kind of trending with the state averages. You're seeing a graph that's there from the date of testing we started collecting was a 412 for Todd County, cumulative cases as well as daily cases. And we're seeing that spike in our daily cases, and then now they're starting to go down. And we're hoping that we're beyond that spike, but we're also seeing community transmission. So as we had that spike, the longer that goes out, the less even in their homes, you're gonna see transmission, because you have about a 5 to 10 day window to where that they could be, those positive cases could be transmitting the virus within the home. So we kind of see that there might have been a spike within that 5 to 10 day window of that spike, but we're broaching that. As of today, we're thinking we haven't been able to get on RedCap this morning. Our access was either denied by the state or the website is down. We had a question out to them and we hadn't received an answer yet, but we're thinking we're gonna have about 328 cases. That was the last time we looked at 3 o'clock yesterday afternoon, which was a 9 case increase from the previous day. Minnesota has tested 25,208. And then of that, 2,725 are healthcare workers. And this is coming from the state website. As of today, they tested 255,592 tests have been completed. Deaths, we have 1,050. And the highest deaths noted at ages between 80 to 89 years of age for the state. Currently hospitalized through the state is 549 people, and in ICU is 253. Like I said, community transmission is widespread.
How many hospitalized in Todd County?
We don't get that information,
Oh,
so I can't
okay.
answer that.
Ventilators, do we know how many are on? Maybe you said that, I didn't
I
catch
think
it.
we talked about that early.
At the state level?
Oh, at the state
yeah.
level. They did talk about it early in the pandemic event. I don't have that number with me today.
Jackie, do you know, like in a situation here where there's an identified case, then do they do testing for others in the household, or do they just quarantine?
They recommend quarantine them. The testing is available, so if people do want to be tested, generally they would prefer that people are symptomatic
Right.
when they go through the curbside, because when you call in to Centricare or Tri-County or Lakewood, they're going to ask you a series of questions to deem whether you are needing testing. There are some sites that are testing people just to see if you want to see if you're positive, and people have been tested and have 0 symptoms and come back positive as well. We know that there are some in the community that have had that result, so.
And then you can do testing by request to see if you've had it in the past by a blood test, is that correct?
There are serology tests that are available for people if they want to see that they've had it. I don't know how widely available it is in our communities yet.
And do you, or can you speak on the reliability of those
I
tests?
can't.
Okay. I've read on it a little bit, I just
Yeah.
didn't know if you had information
No, I
in
don't,
regards to it.
we're not
so-
getting that information through MDH or CDC. So we get outside information, you just wonder how reliable that information is, where we're pulling our sources from.
Right. Do you know the general reliability of the actual testing for COVID? I mean, is it
I can find that out, but I,
98% accurate that,
I
you know,
don't-
like you said, of somebody
yeah.
going in that has no symptoms, but they test positive?
there was a question, and I can't remember, I've been on so many meetings and webinars that they've questioned that the efficacy of the test. So tests are being done on a priority based on if you're a healthcare worker, you're an elderly adult, you're in congregate living, or you're testing from a packing industry. And I believe it goes from 1 to 5. So at 1, you're at a higher priority, at 5, you're at a lesser priority. Those at a higher priority they're getting their results turned around quicker, and depending on where they're sending these specimens, some of them are going outstate, some of them are going to St. Paul. They're questioning that the efficacy in those tests that are, so if you're a priority 5, you wait until there's time to run your test. If you send your test to Kansas, that some of the potency of that swab that may be lost in transport and in waiting at the lab.
Sure.
That hasn't been confirmed, which is going to give you
Right.
a false negative.
Yep.
Or are there false positives? Do you know?
There are false positives,
Yeah.
but there are also some false negatives
Yeah.
too. Yeah.
Just curious.
And they're also starting to recommend that you have a 2-test series, 2
Oh,
weeks
really?
apart,
Wow.
possibly because of the reliability.
At this point then, in our state, are we still following up with, the contact tracing type stuff and whatnot, or?
We were doing contact tracing in the beginning. It became very overwhelming very quickly when we were doing mass testing within the community. To do that on top of assisting with the mass testing became too overwhelming. So at that point, we stopped doing community tracing with MDH. We haven't taken that back yet because the state is hasn't really, decided how they're gonna fund FTEs to do that, and what it's gonna look like when we move into that model of opening up the center.
And actually, I mean, if they're waiting or if they're behind, is it not kind of senseless?
Yeah,
Okay.
we're finding some of them are already out of quarantine by the time the state gets around to them to do the contact
Too far
tracing.
behind the 8 ball to
Yeah,
even
that's
make
a-
any sense.
I tried to pick a nice
Which was
word.
why we kind of wanted to take that on, and then our numbers went, boop, they spiked. So it became very overwhelming quickly. And we have a diverse population where we're needing interpreters, and it became difficult to ask to set those up, and really difficult to do those case investigations quickly.
I wasn't sure if I had understood it in the reading that I had been doing, if the state was actually kind of trying to take charge of that whole realm of things, or if they were shoving it locally, or,
They are trying to take charge of that, but they're also looking for help. But they really don't know how they're gonna reimburse counties for the FTEs to dedicate towards it. And it's very, very consuming, time consuming.
I would believe it, yes.
Mr. Chair, Jackie, is there anyone, or what part of the state of Minnesota is growing or has the largest number of cases? Is it still the metropolitan?
Right.
It is the,
The website does have that on there, but, and not having that up in front of me, but the metro area where there's larger populations, we are seeing a rise, and with community transmission, we are at an advantage being in a rural area. So, yeah, but you're still seeing your large box stores open with large number of people there,
Yeah.
so, yeah, it's.
So, Mr. Chair, I got a question. So, our third case was diagnosed on 4/20, April 20th, which was 43 days ago. So our number's at 318. Is that third case still on at 318?
Yes, they
Okay.
never drop off once they go.
They
up.
never drop off, do they?
No,
Okay, so then out of a population of 24,500, our cases are very, very small.
correct. Correct. So of those, today we're probably reporting 328 cases, yesterday being 319 or 318. You're right, Commissioner Newman, 159 of those are in quarantine, and I believe most of those are going out of quarantine as of yesterday.
Right. But when people do call, like, who's in the hospital and stuff, we can't answer that question
Yeah, and
because
we-
we have no idea.
Right.
I think it's very few though, but if any, so
Right.
the hospitals have been preparing really for nothing. And they waited for this curve, and I think I agree with Jackie, we're beyond the curve, I think, so. If they're putting people under that are from day one, Randy, they're way behind the 8 ball as far as accurate numbers, current active COVID numbers. Cause these people are off the list already, should be,
Right.
so,
Mr. Chair, if you recall, there was many weeks where we weren't able to test
yeah.
hardly anybody unless you were
Right.
a healthcare worker in congregate living. So those,
And I think most of us are aware right now, the biggest population it affects is the elderly, and just trying to protect the elderly. So,
Yep, okay, anything else, any questions? Thank you, Jackie.
each, board meeting, I'll come in with these averages.
Yep.
And then we will post this on our website after the board meeting.
Okay, good, thank you. All right, next, discussion on reopening to the public. I don't know what we can discuss. Is the governor supposed to give some statement today?
Mr. Chair, I had a conversation with Representative Poston this morning on my way over, and he said to tell the board that there's gonna be some good news coming out of the governor's office, either today or tomorrow, about outstate Minnesota opening up. So, we just pray to God that he sticks to his guns with the situation that was going on in, Minneapolis this past week. representative felt that the governor and the attorney general are under a lot of pressure, that they gotta do something good for the people of Minnesota, so we'll see what happens. But, that was, exciting and positive this morning, and, I
When,
just-
when does he usually give his update?
Usually, if I may, Mr. Chair, usually at 2 o'clock each day, he has a press conference. I think I had heard today at 2 o'clock, he was gonna be talking about, the incident that happened down there in the last week. So, maybe he'll also do that on top of, but it generally is each day at 2 p.m.
But, the governor is getting a lot of pressure from the representatives from greater Minnesota as far as, opening up our bars and restaurants. It needs to happen. So, just pray he follows through.
Well, I've been supportive of we've talked about, we want to hope our businesses can reopen, and we've developed a good plan for the county to reopen, and I'm hoping, and I think we've also set out a boilerplate, or most chambers have, for the businesses to reopen during this situation. I don't know how long we're gonna be under this situation, but I think the businesses owners, well, I know they're responsible enough to do their own business plan. They're not gonna just let people herd in like a bunch of, herd in like crowds. And churches are doing the same thing. They're trying to abide by the reopening process and abide by the rules that have been set up by the state and the governor. I really truly believe that the governor has to trust our business owners to do the right thing, and I think they will. So that's time for him to say, open up, have a plan, and start business.
Mr. Chair, if I could, I think the other thing is no one has to go into a business they feel uncomfortable going into.
Right.
It's the freedom of the people to be able to go where they want to support and where they want to go. Absolutely.
And I think you guys are all aware, as I've just said, I was at some big box stores again this week, yesterday, packed full of people. They want to get out. It's obvious as soon as they come out of the stores, they're taking their mask off, and I've seen elderly people out too, but, it's time. These businesses are gonna go under if they don't open the doors soon, if they haven't lost enough that they can't recoup. I don't know. It's just, we're in a dangerous situation here, so hopefully he reopens these things and allows businesses to open with good common sense and have a business plan, so.
And Representative did make the statement that most of our business owners probably have a better plan
Yeah.
of opening up than the state does.
Right.
And I really have to agree with that. So, we just gotta pray to God that the governor pulls the pin.
Yeah.
Yeah, opens it up. Well, if he doesn't, I think then we as a board need to talk more. If he stays with what he's doing, I think we as a board need to talk a little more then later on. We'll see what he does this week. Our next board meeting is when, June 16th? And if he doesn't do something, then I might call a special board meeting and have some discussion, so.
And Mr. Chair, I think what we should do too is try to bring that discussion up at our AMC district meeting.
Yeah.
And see how the other 14 counties.
How's our survey that ended? What did that, I never looked at the end result.
Mr. Chair, the survey had, I believe it was 624 responses, and it was, I'm going to say over 60%, 70% that were in favor of the businesses would be responsible in opening and the people would be responsible, and felt that we should just open.
Can we forward that to our representatives and our governor?
Yes, I will do that today. If I could follow up, Mr. Chair, I did last week have a conference call with some of the business owners, and the business owners had some great ideas, some really creative ideas on how to get their businesses back up and running, but again, lots and lots of struggles and challenges on just the limitations of their outside space, and if they would have the opportunity to open up indoors, they could possibly get more on their feet at this time, so.
Well, we just gotta have, I believe these business owners, they're business owners for a reason. They know how to use their heads and how to organize things, and that's their business. So they're not gonna, do anything stupid. They're gonna reopen with a good plan, I'm sure. So I have faith in them, and I think the governor needs to come off his high horse and have faith in our businesses too, so. But I think our representatives should see our survey from our county, and
Mr. Chair, if it would be appropriate, I will get that sent off today, and I would also make a request of AMC to have this as a topic on the agenda if necessary.
and send our survey to AMC too,
Okay?
and MRC, because I've been on their tail. That's 39 counties now, and I have been hounding Dan Larson to get some action done here by these 39 counties, so that should have some impact down there.
I will do that.
Okay, thank you. Anything else on reopening? I guess we'll just have a little patience here and see what he's gonna do, the governor, and if he doesn't do something, I really wanna call a special board meeting and have more discussions, so.
I guess I've got one question. Are we going to start having work sessions again, or what's
Well,
your feelings on that?
I haven't, because we haven't been allowing the public in here, and I've been delaying it, but I don't know how long we're gonna continue this. If we move back to our chairs, then I will open it up to a work session.
Mr. Chair, today or tomorrow, whenever the governor does make an announcement, hopefully he will, we will listen for that restriction that's in place right now on the 10 or less, and I think that's gonna tell the tale for us on
Yeah.
when we can open up, when he
And
lifts that restriction.
When we do, I would hope we would do every other chair and just make spaces here for the public to sit and then, have it organized enough, so. So that's when we will do that, if I,
We're basically 6 feet apart up there.
yeah, we are really.
As long as I don't have to sit by you.
We're not gonna get into that now.
Nice space.
Okay, anything else?
So, Mr. Chair, I do have a board action regarding the continued discussion on the plan for the county to reopening.
Okay.
So,
Oh, I'm
just,
sorry.
just kind of an update from our last board meeting. It was requested that I bring this information back to this board meeting to talk about how things have been going. And just to let you know that we have had some offices within Historic Courthouse taking by appointment only. And it's been going well. It's a little bit rocky with brand new software and learning how to use that and having the public, getting them to understand how to use it. But to date, the recorder's office has been able to process 53 driver's license. Last week was a short week, so I think with new software and having to clean the machine after every single visit, they've done a very good job at taking care of some of that business. This week, we are going to have administration staff facilitate the taking of the phone calls so they can process even more driver's license just to get more people through the process in preparation for when we do open our doors. Auditor's office has taken by appointment as well for some elections functions. And as of starting June 8th, the Planning and Zoning Office is also going to be taking by appointment only. Assessor's Office is doing that as well. Those are all really customer-focused type services. On the client-focused type services, those are being, instead of using appointment software, those are being initiated by worker-client conversations, and the worker is just taking care of that. So I think again, we are providing the best service that we possibly can in this time, and I would like to take a look at this again, possibly at the next board meeting, to see if we are at a point where we can move back to having board meetings with the public present, just depending on what the governor says.
Mr. Chair, after our last board meeting, I walked out and there was a gentleman that wanted to get in. He needed his driver's license had expired. And I said, well, call and make an appointment for the next week, because the next Tuesday it was gonna open up. And so he was just flustered as hell, because his driver's license had expired.
They're afraid they're gonna get cited, or tickets, so.
Yeah.
And Mr. Chair, I understand they have 60 days.
Yeah, and I don't think they're issuing citations for that anyway. They might issue a warning or something, but I think the state
I
patrol.
believe it's actually right on their driver's license that even if they expired during this whole episode, that it's noted on the driver's license.
What are they doing, Steve, with license plate renewals?
Deputy registers are open. You can do it, you're talking about license plates?
Yeah,
Yeah, deputy registers are open. We're a private one here, so that's open. A lot of the public ones are you can do it online.
yeah, okay.
I think they had a window that they,
Yeah, they do, yeah. But they had closed down for a while, I thought, so.
Correct, yeah, they closed down for a little while, then they allowed the private ones to open back up.
Okay. Okay, anything else, guys? I think the reopening has been going really smooth. I don't think if there's any issues. The thing that probably we're gonna have a little difficulty is trying to convince workers to come back to their offices. It's,
I think the majority appreciate the fact that we're going through a slow and well-thought-through process and a phased approach, so this still allows us time to get other safety practices in place and make sure that all staff are feeling comfortable with coming back to the workforce. The recommendation still is that if you can work from home, you should. So there are still a lot of services that can be provided online and through virtual means, and I would just hope that we could continue in a slow and phased approach in our opening.
I think you told me yesterday or last week that planning and zoning has been going really good as far as apps and,
They're actually ahead of where they were last year, so I mean, they've processed more permits and very busy, and I've heard that story from other offices as well, just very busy with the services being provided, so.
I think the hard ones in regards to that is like the planning commission and stuff like that, where you have the customer not able to be here to
Yeah.
represent themselves, you know, in a face-to-face type thing. That to me is much more important sometimes than,
the CUPs probably, huh?
yeah.
So, Mr. Chair, I am having discussions with Adam on how we could potentially facilitate the next meeting being an actual open type meeting with even just having one of the persons coming in at a time to be able to speak to the commission, so.
Now, on the 15th, we have the Board of Appeals. I've talked a little bit with Chris about that, so we're gonna have by appointment only?
We are.
And then where would they wait for their appointment, outside?
They would, and we would facilitate that with maybe having an additional staff person sitting there, letting the person know when they can come in. Using the software, they would get either a text message or a phone call saying it is now your turn.
Okay.
So we could be very efficient, have somebody up here already speaking, have the next person waiting in the entry able to come up as soon as this person was done.
So if we're still sitting in this situation, would we have a podium or a microphone or something?
We absolutely could, and we could facilitate it right in the doorway if we needed to.
Somehow, if that happens, I'd like to see this in a horseshoe. These two commissioners can't see what's behind them. So if we could have a horseshoe shape so we can actually see the person coming in,
We can do that.
yeah. Because that's not fair to these two not to be able to see them, unless you sit on that side of the table.
Behind
but-
Dave, right?
Huh?
Sit behind Dave.
Yeah.
Do we have a few appointments at this point?
We do. I believe the last time I checked with Chris, and it's been about a week since I've checked, he had 15 appointments. Some of those, sometimes he can take care of those just talking through on the phone. I would anticipate that number to probably stay right around that range because he may have had some that have come on and maybe some that he's been able to take care of. So
So, Mr. Chair, we'll get a list of them.
I can request
and
that.
the townships that they're coming.
I think he
Nice.
sends that out usually,
Yeah.
doesn't he?
Yeah,
Yeah,
wanna make sure we get it.
Yeah.
okay. Anything else on?
So I have since it's a board action, I do have a recommendation to continue providing services online by phone, email, Dropbox, and by appointment only for those areas in where person appointments are necessary, and reevaluate on June 16th Commissioners Board meeting.
Okay, you've heard the request for the board action. Is there a motion?
So,
Motion by Commissioner Kenizel. Is there a second?
Second.
Second by Commissioner Erickson. Any more discussion? If not, all's in favor say aye.
Aye.
Opposed? Carried. Thank you.
Thank you.
Okay, standing reports, auditor treasurer.
Just one announcement that the filing closes today at 5 PM, so we'll be open till 5.
Okay. And as far as commissioners, I don't know about you guys, but most of my meetings, just about all of them, been Zoom, and sometimes I like them and sometimes I don't, so. Have you ever tried to have a meeting with 39 counties online?
yeah.
That was a treat last week.
I'm gonna one-up you, Dave. I'm gonna say I don't like any of mine.
Yeah, okay.
They're
I really
very
don't
hard.
either,
Yeah,
but,
it's pretty much like non-personal.
yeah,
Very hard.
I had
kinda like-
one,
it's
I had
kinda
one,
like
I had to watch my
texting.
2-year-old granddaughter,
yeah.
so I, trying to get signed in, you know. They could see me and everything, that I was there, and all of a sudden, I don't know, she distracted me, and so I punched her around with some goddamn thing. And so then, one of them people texted me, "Are you gonna come back?" And I said, "No."
Yeah, that 39 county one was a challenge. I finally hung up. I said, I can't take this anymore. Everybody was talking over everybody, and it was a mess. So hopefully we'll get back to normal pretty soon. So I don't have anything to report. We want to thank Chris and everybody in the county level that's been working hard to keep this running smoothly. The EOC has been meeting, and actually we're kind of slowing down, running out of things to talk about. So everything should hopefully get back to normal, see what the governor wants. So we'll recess until June 16th.